All right, infections. We've got the TORCH is an acronym, TORCH infections. That's toxoplasmosis. This is transmitted via cat feces. That's what they'll often tell pregnant women not to change the litter box. Sometimes can lead to serious eye and brain damage in the infant, can lead to low birth weight, enlarged liver and spleen, jaundice, anemia, and neurological damage. O is for other infections. R is for rubella. This can have serious fetal effects. These are found on page 109 in your book. Things like microcephaly, intellectual impairments, congenital cataracts, deafness, and cardiac defects. So that's obviously a big problem, and why they check to make sure that the mom is immunized when they do prenatal counseling. C is for cytomegalovirus, CMV. This is an asymptomatic mom, meaning she doesn't have any symptoms, obviously, but has serious fetal effects. These are also listed on page 109, such as intellectual impairment, seizures, blindness, deafness, dental abnormalities in the infant. And H stands for herpes simplex. So we've got type 1 and type 2 that can lead to fetal death, again on page 109. If there are active lesions, active herpes lesions, what type of delivery is going to be needed, C-section or vaginal delivery? If there are active herpes lesions, we must do a C-section so that the herpes virus does not get transmitted to the infant in delivery. We also have group beta strep, GBS. This is actually normal flora. It's normal bacteria for many women. So it's commonly found in the vaginal tract for many women. They are asymptomatic. They do not truly have an infection. It's normal flora. But it can infect the fetus during labor and birth, and it can be fatal to the newborn. So they do GBS screening at 36 to 37 weeks gestation, where they will do a vaginal swab. They swab in the vagina and down the perineum and right at the rectum to swab for any group beta strep. If she is positive, they will do antibiotics during labor, preferably penicillin, usually penicillin unless she's allergic, and they will do it preferably at least 4 hours before delivery so that she can get 1 to 2 doses of the antibiotic in. And that's one of those things that's really important for us to know even after the baby's been born, is if the mom was GBS positive, was she treated? If so, how many doses did she get of the medication, etc. Because that helps us know if we need to go ahead and treat the infant or assuming that the infant's going to have the infection, because again, it can be fatal. Can lead to pneumonia, sepsis, respiratory distress, apnea, meningitis. Diagnosis is done, I told you, at the vaginal rectal swab at 36 to 37 weeks gestation. All right, substance abuse. Substance abuse includes illegal drugs, tobacco, and alcohol. The fetus is at greatest risk in the first trimester because of teratogenic effects, but still serious effects throughout the entire pregnancy. Be sure you see table 5.9. It's on page 114 in your book. Alcohol, cocaine, marijuana, tobacco, anticonvulsants, ACE inhibitors. Okay, these can all cause complications and things that we really need to know if she is using those drugs or not. Okay. All right. Be sure and let me know if you have any questions. This was another long lecture with tons of information. Again, I'd highly recommend that you try to make a chart or flashcards or something to help you list all of these different tests that we talked about and the different illnesses, problems that can occur with pregnancy, and what we're going to do for them, how we would recognize them, etc.